All right, everyone, Dr. Reza here at Artelon Pediatric Dentistry, and I wanted to kind of go over the overall setup for SDF. Now, I know when we're talking about silver diamine fluoride, this looks like it's a lot of stuff, but I'm not using this setup for all patients. I just wanted you to get an idea of everything that I might kind of have. So we're going to kind of go through this real quickly, and then later we can talk about actual applications of it. But let's go over the armamentarium and a few of the things we're going to look at. So obviously we want to have safety glasses for the patient. We also like to use a little bit of petroleum jelly, like a little Vaseline, to go around the outside of the lip. We try to be obviously very careful with the SDF, but if you get a little bit that gets past it, this is a nice barrier. So we have this ready to go. Sometimes you can also use some chapstick. So lip balm works as well. If you're going to be doing things interproximally, you can use like floss, that's like the little floss sticks, but I really find if you can control it, the super floss actually works really, really well. So super floss, it's a little more absorbent, so it can actually hold the SDF a little bit better. Obviously, we have a basic setup. I typically, Mirror Explorer, sometimes I'll use a little spoon excavator to do a little caries excavation. I at least want to try to get out as much of like the food debris and plaque before we put the SDF on, but you don't have to do complete caries excavation, but everything is here. A mouth prop or a mouth molt, sometimes you're going to need a little assistance getting kids to stay open. As far as isolation, I tend to be in the gauze world. So just gauze, kind of trying to isolate the teeth and keeping the lip and the tongue out of the way is fantastic. You can use various types of cheek retractors, cotton rolls as well. In addition, you have your Diamine dishes and everything for your SDF and fluoride. So with the silver diamine fluoride, there's lots of different versions. I use Advantage Arrest, and I like the bottle dropper. The applicator that's used is usually this little fuzzy micro brush. So this absorbs it really, really well. And then I have a separate Diamine dish with our fluoride. I also tend to use the Fluoramax from Elevate because it's in a dropper form and it does a really good job kind of covering. You can use whatever type of Diamine dish. I like to use the plastic ones because listen, this is SDF. It is going to stain. So these are disposable and everything is nice and clean. You can take away. When you have your display, this is for purposes of like the video, but I will say, like, when you have like the patient bibs that have the plastic lining underneath, that helps. One of the things that we do in our office is we put it on a tray, but actually have like plastic, like almost like a chair cover, if you can see this, that goes over the tray. So in case anything spills, we have it, but it's also nice when we're done, this just kind of covers everything. So that for disposing of it, it works out well. So this is the basic setup. It has pretty much everything you need. Depending on what I'm doing, I might pick and choose. If I'm not doing anything interproximal, I don't need half of this stuff. If it's just a very quick one, I might have just my Diamine dishes and the rest of the materials that you see here. So this is what I typically use to apply SDF, and hopefully this will be a good start if you decide to use it in your office.